Hello, my name is Matthew Stevenson, and today I'll be presenting a narrative review examining the potential impact of novel tobacco and nicotine products on cardiovascular health. Here is my conflict of interest statement. As a responsible manufacturer, Imperial Brands applies a multi-stage, multidisciplinary scientific assessment framework, or SAF. The SAF supports evidence-based assessment of product safety and substantiates the tobacco harm reduction potential of our next generation products, which includes post-market surveillance of the published scientific literature. The review I'm presenting today sits firmly within that approach. Whilst the risks of smoking on the cardiovascular system are well known, the cardiovascular impacts of novel tobacco and nicotine products are often discussed in a fragmented and inconsistent way. Our aim of this review was to integrate mechanistic, clinical, and population-level data to assess whether switching from cigarettes meaningfully reduces cardiovascular risk and to inform evidence-based harm reduction discussions. This narrative review covered 221 publications and focused on 4 key areas, including in vitro and in vivo cardiovascular disease models, human clinical studies, population-level assessments, and finally, how regulators are evaluating cardiovascular risk. However, due to time constraints, this is out of scope of today's presentation. I should note that this review is currently undergoing journal submission and review. Cigarette smoking is a cause of serious disease in smokers, including cardiovascular disease. Atherosclerosis is reportedly responsible for the development of most cardiovascular diseases and develops through a pathway of endothelial dysfunction, lipid infiltration, macrophage recruitment, and vascular remodeling. Smoking was reported to be responsible for 1 in every 4 deaths in the United States from cardiovascular disease, and smokers are reportedly 2 to 5 times more likely to experience both fatal and non-fatal cardiovascular disease events than non-smokers. While the level of cigarette consumption may influence the degree of cardiovascular risk, even low levels of cigarette smoking significantly elevate the likelihood of development of cardiovascular disease. Evidence from the reviewed in vitro studies consistently show that e-vapor and heated tobacco product aerosols are far less cytotoxic than cigarette smoke. We see reduced endothelial damage, improved wound healing, lower inflammatory signaling, and reduced oxidative stress, all key drivers of atherosclerosis. In vivo mouse models, cigarette smoke markedly increases plaque burden and cardiovascular dysfunction. By contrast, exposure to e-vapor or heated tobacco product aerosols results in substantially lower plaque development, often comparable to smoking cessation or switching groups. Turning to clinical trials, smokers who transition to e-vapor products, heated tobacco, or nicotine pouches show marked reductions in exposure to key cardiovascular toxicants. In many studies, biomarker levels approach those seen in abstainers or never smokers, demonstrating a substantial reduction in toxicant exposure when cigarettes are displaced. Beyond exposure, we also see improvements in biomarkers of potential harm within 3 to 12 months of switching. These include reductions in inflammatory markers, platelet activation, and oxidative stress, alongside improvements in lipid profiles. Importantly, these improvements are often similar to those observed with smoking cessation. At the population level, most evidence comes from surveys conducted in the United States, which are largely cross-sectional in nature and are prone to clear limitations around confounding and disease timing. However, when smoking history and temporality are properly accounted for, exclusive e-vapor use is not associated with increased cardiovascular risk and is consistently associated with lower risk than continued smoking. Emerging data from heated tobacco product populations, particularly in Japan and South Korea, also suggest harm reversal relative to smoking. However, key evidence gaps remain, especially for long-term health outcomes and oral nicotine pouches. In conclusion, we observe strong convergence of evidence across experimental, clinical, and epidemiological studies. Exclusive switching to next generation products reduces exposure to cardiovascular toxicants, improves biomarkers of cardiovascular health, and lowers cardiovascular risk compared with continued smoking. The key message is that supporting complete displacement of cigarettes with novel nicotine products has the potential to substantially reduce cardiovascular disease burden. These findings reinforce the potential role of next-generation products in tobacco harm reduction, and Imperial Brands remains committed to advancing robust science in support of evidence-based proportionate regulation. Before closing, I'd like to thank everyone involved in this work, and I'd like to thank you for your attention.